What to do if you have a heart attack while alone. These measures could save your life. Welcome to Organic Awakening, where we bring you essential tips to protect your health and well-being. Today's topic is not just important, it's life-saving. Did you know that the World Health Organization, WHO, emphasizes knowing how to act in the event of a heart attack, especially when you're alone? Imagine this. You're alone, whether at home or work. It's quiet, just another ordinary day, until a strange pain appears in your chest. At first you think, it's probably just fatigue. But the pain grows stronger. Suddenly you're sweating. Not regular sweat, but a cold, clammy sweat. The discomfort spreads to your left arm, neck, and your breathing becomes labored. Your heart races, and then the realization hits. You're having a heart attack. But the worst part? You're alone. Would you know what to do in such a critical moment? Every second counts, and the actions you take could mean the difference between life and death. In today's video, I'll guide you through step-by-step recommendations backed by the WHO on how to respond to a heart attack when no one is around to help. Can coughing really help? Should you take medication? What you do in the next few minutes can save your life, or someone else's. Stay tuned and remember to like, subscribe, and share this life-saving information. Every detail matters, and together, we can help more people take control of their health. Let's dive in. Symptoms of a heart attack. Let's recap the signs. Here are 7 key symptoms that might indicate a heart attack. Chest pain, a crushing pain or pressure in the center of your chest, often radiating to your arm, neck, or back. Sweating and pallor. Intense, cold sweat that leaves you pale. Nausea or vomiting. A feeling of sickness, especially in women, where it's often misdiagnosed. Dizziness or fainting, caused by low blood pressure or heart rhythm irregularities. Shortness of breath. Difficulty breathing, with or without chest pain. Numbness or heaviness in the left arm. The pain may also extend to both arms, hands, or elbows. Extreme anxiety, a sense of impending doom, similar to a panic attack. If you recognize these symptoms, it's essential to act fast. Steps to take. If you're alone. During a heart attack, call for help immediately. Dial emergency services or a trusted contact to take you to the hospital. If the ambulance might take longer than 15 minutes, ask a neighbor, call a taxi, or use a rideshare service. Time is critical. Stay calm and alert. Sit down to avoid fainting. Loosen tight clothing and focus on slow, steady breaths to maintain oxygen flow. Take aspirin, if available. Chewing a 300 milligram aspirin tablet can help thin your blood and reduce clot formation. Avoid physical exertion. Rest as much as possible while waiting for help to minimize strain on your heart. Your survival depends on acting quickly. Share this knowledge. It might save someone else's life too. Have you or someone you know experienced a heart attack? Let us know in the comments where you're from and your story. Now you might be thinking, if time is so crucial, wouldn't it be faster to drive myself to the hospital if I'm having a heart attack? The answer is no. Let me explain why. During a heart attack, your heart is under extreme stress. A heart attack occurs when blood flow to the heart is blocked, typically due to a clot forming on a fatty plaque buildup in the wall of a coronary artery. This blockage prevents the heart muscle from receiving oxygen. Without oxygen, heart cells begin to die, and the longer the delay in treatment, the greater the damage to the heart. It's as if the heart is trying to breathe through a pipe that suddenly becomes completely clogged. The muscle suffers, and depending on the affected area, this can lead to death within minutes. This is why time is critical. 50% of heart attack deaths occur within the first hour. It's very common for a person to experience a sudden drop in blood pressure or develop a severe arrhythmia, which can cause sudden loss of consciousness. Imagine passing out at the wheel, not only risking your life but also the lives of others on the road. Even if you feel capable of driving, the effort of steering, shifting gears, and focusing on the road can worsen the lack of oxygen to your heart. Symptoms like shortness of breath, dizziness, or worsening chest pain could incapacitate you while driving. This is why I always emphasize: ask someone to drive you to the hospital or wait for an ambulance. To ensure paramedics can assist you quickly and effectively, keep your doors unlocked. If you have pets, secure them in a closed room to prevent complications when help arrives. Also, have your list of medications and allergies easily accessible, either saved on your phone or in your wallet or purse. While waiting for help, stay calm and conserve energy. I know it's hard to stay calm during such a critical moment, but panic can make things worse. Try to breathe slowly and steadily, even with the pain or discomfort. This helps reduce strain on your heart and conserves your body's energy. Sit or lie down in a comfortable position. Choose a position that alleviates pressure on your heart, such as sitting with your back supported and your head slightly elevated. This improves blood flow and prevents you from falling if you lose consciousness. Avoid physical exertion. Do not attempt to lift heavy objects, move around excessively, or perform tasks. The goal is to minimize strain on your heart. Remember, every movement requires more effort from your heart muscle. If available, take aspirin. If you are not allergic or have no contraindications, chew 2 to 3 tablets of 100 mg aspirin. Chewing allows faster absorption into the bloodstream, helping prevent platelets from clumping together and worsening the clot. This can maintain partial blood flow until medical help arrives, reducing the severity of the heart attack. Does coughing during a heart attack help? You may have heard that vigorous coughing can save your life during a heart attack. It's time to debunk this myth. This so-called cough CPR has been circulating online for years, but has no medical or scientific basis. A heart attack happens when blood flow to the heart muscle is blocked, usually by a clot. At this stage, the heart is still beating, meaning you are conscious and do not require CPR, which is only necessary when the heart has completely stopped. The idea behind this myth is that repeated coughing could act as chest compressions to restore the heart's rhythm. However, this makes no sense during a heart attack because the issue is not the heart's rhythm, as in arrhythmias or cardiac arrest, but a blocked artery. Coughing won't unclog an artery. Should you take vasodilators during a heart attack? Avoid unnecessary self-medication. Aspirin is effective and part of the recommended treatment for heart attacks, but vasodilators do not reduce mortality. Moreover, if you've taken medications like Tadalafil, Cialis, or Viagra, vasodilators can cause severe complications or even death. In cases of a right ventricle heart attack, vasodilators can also be dangerous. So, don't improvise. Stick to proven treatments and await professional medical help. What to do if you find someone unconscious during a heart attack? If you encounter someone who is unconscious and not breathing or showing signs of movement, act quickly. They may have experienced a sudden cardiac arrest caused by a severe heart attack. Sudden cardiac arrest is one of the most severe forms of a heart attack. It occurs when a coronary artery, often the main trunk or anterior descending artery, becomes completely and abruptly blocked. This leads to sudden heart stoppage within minutes or hours. If this happens, call emergency services immediately. Emergency responders will have the necessary equipment, like a defibrillator, to address the situation. While waiting for them to arrive, perform chest compressions at a rate of 100 to 120 per minute. Do not stop until the paramedics arrive with the defibrillator. Remember, the most critical factor in survival and recovery after a heart attack is receiving prompt medical care. What is the most important factor for a person to survive a heart attack? The key factor in surviving a heart attack is how quickly you recognize the symptoms and seek help. There is a direct relationship between the onset of a heart attack, typically when the first symptoms appear, and the time it takes for doctors to open the blocked coronary artery causing the problem. The faster doctors can unblock the artery and restore blood flow to the heart, the better the outcomes. This not only significantly increases your chances of survival, but also reduces the risk of severe complications, such as heart failure and future hospitalizations. That's why you should always take symptoms seriously and never wait to see if they go away. Recognizing the signs and acting quickly can make all the difference in saving your life and preserving your heart's health. When you arrive at the hospital, assert your priority. If you think you're having a heart attack, don't wait in line. Time is muscle. Your muscle, your life. I've worked in public health for years and have seen patients pale, clutching their chest, waiting in the triage line. Of course, I called them immediately for an ECG, and they were indeed having a heart attack. Don't wait in line. If a doctor dismisses your symptoms without an ECG, insist on it. At the very least, an ECG and blood enzyme tests are essential. Who is most at risk of a heart attack? Men aged 45 or older and women aged 55 or older are at higher risk. Other risk factors include smoking, high blood pressure, high cholesterol, diabetes, obesity, physical inactivity, high stress levels, family history of heart disease, use of illicit drugs like cocaine. However, some people without these risk factors can still experience a heart attack. How can you protect yourself from a heart attack? Most heart attacks can be prevented by taking proactive measures to improve heart health. By making healthier choices and addressing risk factors, you can significantly reduce your chances of a heart attack. Adopt a balanced diet. Eat fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting trans fats, saturated fats, and added sugars. Exercise regularly. Physical activity strengthens the heart, improves circulation, helps maintain a healthy weight, reduces stress, and boosts mood. Aim for 75 minutes of vigorous exercise, like running, per week, or 150 minutes of moderate exercise, like walking or cycling, per week. Maintain a healthy weight. Avoid smoking, prioritize sleep, and manage stress. Treat underlying conditions. Uncontrolled hypertension, diabetes, and high cholesterol significantly increase heart attack risk. Have regular checkups. Take a deep breath and remember, the information you've just received can save lives, perhaps yours or someone close to you. Recognizing heart attack symptoms and acting quickly makes all the difference. It turns an emergency into a story of survival. The heart is the engine of your body. Take care of it with love. Spread this message. Share this video with your friends and family, because the more people know how to act in a critical moment, the more lives can be saved. Thank you.